welcome to today's Lunch and Learn. Hello, everybody. I'm Dr. Erica Oberg, and I am the medical director of Marqi Medical. So happy to have you all here with us today. We'll give it just a minute or so for some additional people to log in here, but I hope you all have a tasty, healthy lunch in front of you and that you're ready to learn some new things today. I love doing these presentations on LinkedIn because it's a great opportunity to talk to really our key audience of high performers. And I know you all have very tight schedules, and so Lunch and Learns are a nice way where you can take some time out to enjoy your lunch and learn with us here. So thanks again for being here. And we'll give it just a few more seconds here. Looks like everybody's clicking in nicely. Wonderful to see everybody here. All right, sounds good. Well, let's cue up the first slide here. Perfect. So my name is Dr. Erica Oberg, and I am the medical director of Marqi Medical. And I am happy to be here with you today to talk to you about 10 hidden metrics that drive longevity and peak performance. We call this the Elite Healthcode because knowing these metrics are going to be powerful tools that will help you unlock your full health potential. Next slide, please. So how many of you know somebody who seemed like they were doing just fine and were very healthy and then all of a sudden weren't? Unfortunately, it's a very frequent situation, especially for CEOs and high performers. Many of them get caught out of the blue with health risks and significant health issues that they didn't see coming. Next slide, please. And that's because of stress. The underlying cause of most of the hidden risk of executive health. Did you know that executives are 4 times more likely to die of stress-related illnesses than the average American? That means 3 out of 5 CEOs have a lifetime risk of dying of a cardiovascular disease that could have been avoided, and 1 in 7 have major medical findings that they don't know about that are silently hiding under the hood. So today we're going to talk about some of the ways that we can detect some of these risks and some of the things we can do today to become more aware of our health status and make some improvements now so that we don't become one of these statistics of people who pass away from stress-related illnesses well before their time. Next. Does anybody resonate with this? Has anybody felt like they were doing all the right things, but they still don't feel 100%? I wish this was an uncommon scenario, but I hear this all day in clinical practice. People come to me and they say, well, I went to my doctor because I just don't feel like I'm on my game anymore. And they ran some tests and they told me, you look good, nothing's wrong with you. And they're like, gosh, but it sure doesn't feel like everything's right with me. And at this point, this is when people usually come to work with us here at Marqi Medical, or they seek out integrative health, or increasingly, just in the last couple months, they might be turning to ChatGPT to try to get some of these questions answered. But it is not in your head. If you're having that sensation that you're doing everything right and you're just not making any progress on your health and well-being, it probably isn't in your head. There probably are things that we can do. Next. And that's because normal isn't optimal, right? So your primary care provider might have told you, looks good, all of your labs are normal, you must be fine, bye-bye, come back next year. But normal isn't optimal. The normal reference ranges are for any lab pretty much is based on a bell curve of the population that they test. And so if you fall outside of the normal zone, if you have flagged high or low value, that means you're in the 2.5% of the population at either end of the bell curve. And while that might be normal, You might fall within the 95% of the population. It certainly isn't optimal. And what I'm passionate about is really helping you get to optimal so that you can perform well and lead your businesses and lead your lives and operate at a higher level of energy and efficiency and well-being. I really want you to thrive, not just get by. Next. So knowing what you can do to enhance your peak performance and drive longevity and be a higher performer in both your health and your business starts with measuring things, right? We can't change what we can't measure. And I'm sure for all of your businesses, you're measuring your KPIs so that you can track your trends, optimize, strategize, revise the business plans. And the same should be true of your health. If we're not measuring our KPIs for our health, how are we going to possibly know if we're making progress, if we're getting better, or where we can start to leverage some of the amazing tools that are out there to help us improve our health? So with that, I'm going to lead into 10 KPIs that you probably aren't measuring and tracking for your own personal health. Next slide, please. So at Marqi Medical, we actually measure 43,000 different data points in your health for each individual. And obviously, that's more than I can talk about today. So I'm going to just talk to you about 10 topics here that are really major game changers and things that you might not be measuring as KPIs. And those are cardiometabolic inflammation, deep sleep, and sleep in general. Your cortisol rhythm, that is the circadian rhythm of your stress hormones, hormone balance in general, your brain and cognitive health, your glycemic variability, your micronutrient status, your heart rate variability, your whole genome, and whole body and brain imaging. So those are 10 KPIs that we're going to talk about here today. And to make this easy, I'm going to present a number of cases from some of our patients and clients so that you can get a sense of what these really might mean for you. Maybe you'll recognize yourself in some of these stories. Next. So let's talk about KPIs of performance and recovery. So these are biometrics that are truly profound in terms of helping with these domains. And these are heart rate variability, your deep sleep, your glycemic variability, and your cortisol rhythm. And all of these give us different data points. So let's look at a couple case studies here. Next. So this is Jim. He's a 57-year-old CEO, and he came to us basically just feeling like he was getting old. He was feeling run down. He just couldn't keep up with things. He was finding himself, sort of zoning out and getting distracted during his board meetings. He was having a really hard time just staying on his game. He'd gained 10 pounds of weight. When he looked in the mirror, all he saw was the bags under his eyes and his sallow skin. And he was just like, dang, I'm not really ready to be feeling this old. I wonder if something's happening. He had some labs run with his primary care provider. He actually had a concierge physician, so he had slightly better than average lab values, and they found some things, some high cholesterol, some high blood pressure, some blood sugar that was creeping up, but nothing that really was enough to explain why he was feeling the way he was feeling. So when he came to us at Marqi Medical for a deeper dive in one of our prevention and proactive programs, we put a sleep monitor on him. So we had him start tracking his sleep at night. And lo and behold, poor Jim simply wasn't getting hardly any deep sleep. You can see his sleep statistics here. Well, he's cutting it a little short on the overall metrics with less than 7 hours of sleep, but that's not too shabby for a lot of people. But when we really look into the metrics of his sleep, he wasn't getting into deep sleep hardly at all. And when we're in deep sleep, a lot of important things happen. That's when we're releasing growth growth hormone that helps us repair and regenerate. It's super important for our brain and what we call our lymphatic lymph system, where sort of the brain cleans and detoxes itself overnight. And so when you're not getting any deep sleep, none of these things are happening. So we educated Jim about this and put some simple interventions in place. In his case, actually, magnesium before bed turned out to be the game changer, as well as some, common sense things such as, turning down the lights, getting off the screens, etc. But it really was a pretty profound change when we started getting Jim sleeping better. And as his deep sleep came up to the 15% or higher, he felt like a whole new man. He was focused in the boardroom. The bags under his eyes went away. His skin tone improved. Sleep was really the game changer for Jim, and he wouldn't know that if we hadn't put a biometric sensor on him to track his sleep night to night. Next. This is a story of another slowing CEO. This is Alyssa. Alyssa came to us with a similar concern. She just really couldn't focus. She was starting to have headaches. She just felt like she had brain fog. She said she felt like wired and tired all the time. She just really was feeling like she was a mess. She went to her OB-GYN. Smartly, they started her on hormones because she was in the just newly menopausal. That helped a little bit, but it didn't really make all the difference that she needed. And so when Alyssa came to us, we ran a much more comprehensive lab panel that included a really key biomarker called homocysteine. So homocysteine is a marker of how efficiently we are using B vitamins to methylate. And methylation is a key process that's involved in so many things: how we metabolize our other hormones, especially our reproductive hormones, how we metabolize things like our neurotransmitters, how efficiently we use our B vitamins and things like folic acid to repair our DNA. So homocysteine is critically important, and Alyssa's level was extremely high. The good news is this is highly fixable. We traded out her poor quality drugstore multivitamin for a high quality methylated B complex multivitamin. And she came in for some B vitamin intramuscular injections for a couple weeks to kind of jumpstart things. But it was a total turnaround for Alyssa. Suddenly she had her brain back. She had enough energy to go to the gym. She noticed she was starting to just feel more vibrant and more vital. And she came in and she said, gosh, I feel 10 years younger. And it's just these simple B vitamins. Who knew? Well, we know, but we were happy to share that with her and help her understand her own physiology so that she could make some simple changes and feel like herself again. Next. So let's look at some other health metrics in a couple different domains. Next. So let's talk about some KPIs of your biologic integrity and energy. So as I mentioned, we look at over 43,000 different metrics when we do our deep dive diagnostics for Marqi Medical members. But simply on the on the biomarker side, on your blood test side, we look at over 400 different biomarkers. And when we combine that with MRI imaging, it really gives us a pretty unique and insightful picture into your biologic integrity. So specifically, we look at things such as inflammation, and this is far beyond the standard HSCRP that maybe you got on your annual physical. We look at micronutrient status because as I'll share with you in a few minutes, that is everything. Of course, we check hormones because that's a key factor. They do change with age, and for many people at the peak of their careers, they're in their 50s, 40s, 50s, 60s, and that is a key time when our hormones are changing. It's almost like going through puberty all over again. So measuring and addressing hormones is critically important. And of course, cardiometabolic risk. And I'm not talking about just a simple LDL HDL ratio. We go into much more depth here. Next, please. So let's talk about cardiovascular risk because it is the number one thing that kills CEOs. It's kind of blunt to say it that way, but it is. And it's not just the cardiovascular risk in terms of your heart, it's your cerebrovascular risk because our brains are probably all of our most valuable assets. So a standard lipid panel, your HDL, your LDL, your triglycerides, it is just simply too blunt and too late. It doesn't tell us anything, and the only tool in the toolbox that most physicians have to address that are statin medications. And many people are intolerant of statins or simply don't want to be on them. So we always run an advanced lipid biomarker profile. And as you can see in this slide, it's a little small, but hopefully you can at least get the gist. What we're seeing here is a picture of a blood vessel and kind of the step-by-step progression of cardiovascular disease, right? We can measure it early on in terms of metrics of just starting to see some of the protein changes. And next, we'll start to see some of the lipid accumulation, some of those soft plaques. We're going to pick those up with numbers like LPPLA2 or an MAO, a myeloperoxidase biomarker in your blood tests. And finally, we hope we find it long before this, right? We have the markers that your heart is actually under stress or that your cerebrovascular vessels are close to putting you at risk for a stroke, right? And we hope that we're not detecting those. We hope we're catching those far earlier. So when we can understand the big picture of where you are in your cardiovascular progression, and I should mention, of course, we always also measure a coronary artery calcium score. That's an imaging test that adds additional information. Now we can understand how much is soft modifiable plaque, how much is highly inflamed or oxidized plaque that's actively causing problems, how much is old calcified plaque, how much blockage is there. And with this level of detail, there is so much more we can do in terms of interventions. It ranges from, fine-tuning your fitness recommendations, right? To turn up or turn down your fitness, as well as, the dietary supplements you might need, anti-inflammatory food programs, nutrition programs. There's so much information we can do when we have this level of granularity of understanding exactly where your inflammatory risk and your cardiometabolic risk lay. Next, please. So, micronutrient status. This is absolutely everything. This is truly where my passion lies because nutrition essentially is biochemistry. Our bodies are made of nutrients, and vitamins and minerals are the signaling molecules for pretty much everything. Everybody probably, can make the connection between calcium and magnesium and our skeletal system, right? Our bones are made primarily of calcium plus a bunch of other trace minerals. And our muscles are primarily made of protein, but there's a lot of other key cofactors in there like carnitine and taurine. Right? Our digestive system needs things like betaine hydrochloride, which interestingly relates to some of that methylation, right? Our nervous system is hugely important. Nutrition is hugely important to our neurologic system, right? We need the appropriate fats to line our nerves. Things like phosphatidylcholine and phosphatidylserine play a huge role here, right? We talked about the B vitamins that play a key role in how our neurotransmitters fire. So when we really know our nutritional status at a cellular level, then we can really make really targeted recommendations around what we eat, what we prioritize in our diet, what we might supplement with, whether something like IV vitamin therapy might be appropriate for you. So really knowing your micronutrient status is critically important for so many reasons. Next. So let's come back to our KPIs here. We've talked through probably a half a dozen of them at this point. So let's move on to a couple more case studies and look at a few more here. So this category of KPIs, I really put in the subset of what I call the predictive biometrics and tools that we use for risk forecasting. Essentially, how worried should we be about where you are? And there are two KPIs that we lean on very heavily there. And the first is your genetic code, right? Not just a little SNP panel that isn't commonly run, but at least it's showing up occasionally, one or two, or maybe a dozen SNPs. We think it's really important to look at your whole genome because once you have your whole genome sequenced, you only need to have it done once. But what we do every year is we re-annotate that because the humans are learning, new connections and new studies are published. So rerunning your genomic data through the new AI calculators that we are constantly modifying and revising helps us really understand your genetic risk. And we'll look at an example here in a second, a case study of genomics. But before I go there, I want to just kind of point out two levels of genomics, right? We think of major chromosomal things, perhaps the things that you or your spouse were screened for, like before the birth of a child, right? Chromosomal abnormalities. Those are obviously major genome changes. But there are a lot of other ones, what we call small single nucleotide polymorphisms. And when we look at those in whole, we can come up with what we call polygenic risk models. So you might have, say, a handful of small changes that aren't going to be life-threatening per se, but they might be impacting, the efficiency of various different enzymes or proteins in your body. And when we look at those as a whole, we can really be very personalized in terms of understanding your risk and therefore what we can do to modify that. Many people don't appreciate it, but our genes turn on and off. They express, they're read in response to their environment. And that environment is almost entirely a nutritional environment. So when we know what your polygenic risk scores look like, we can modify the nutritional environment so that your genes express more appropriately. The other area that we lean on heavily for predictive risk forecasting is imaging. I mentioned coronary artery calcium scores to see how much hard plaque is already in your blood vessels. I'm a huge fan of brain MRIs with quantitative metrics, not just of your whole brain, but of each area. That really kind of helps us understand any early aging and where we might need to be proactive in terms of your cognitive health. Whole body MRIs, those can help us detect things early on. And of course, knowing your body composition, right? How much fat, how much muscle, what's your bone density, all of those metrics come from different imaging technologies and give us so much information. So let's look at a couple case studies to understand how these might play out. Next. All right, so this is Callie. Callie came to us, this was part of her corporate C-suite health package to come work with us. And she was totally healthy. So she wasn't quite sure why she was there. She was doing great. She was running 10Ks. She felt super fit. She had absolutely no symptoms. But this package was part of her executive compensation package. And so she was excited to see if she could learn anything to enhance her performance. And as we went through things, we found a couple things that we uncovered. First, in her blood markers, we saw an abnormal thyroid level. When we looked at her whole genome, we saw a genetic mutation that increased her risk for cancer. And when we did her full body MRI, we picked up a little bigger than a 2.5 centimeter thyroid nodule. And turns out this asymptomatic, healthy woman had early papillary thyroid cancer. And fortunately, we caught it, fairly early. And so this was a surgical solution. It was removed. She's going to be on thyroid replacement medication for the rest of her life. But had we not caught this early with the deep dive diagnostics that we went through, who knows? She was a young woman with 4 children and a thriving corporate career and, living her best life, running her 10Ks. Yet, if we had not found this early thyroid cancer when it was still in a curative stage, who knows what the loss would have been. It breaks my heart to think about things like that, but I'm glad we were able to help her and get her on a healthy path. Let's look at a different case. Next. So this is another example of what we can do with the power of your whole genome. This is a case of sort of the power of pharmacogenomics, right? So our genome impacts how we metabolize things, especially medications, and that's all profiled pretty well in the research literature. And so this was a case study of Sarah. She was a 47-year-old executive. She'd struggled with mental health her whole life, anxiety, insomnia, sometimes depression, brain fog. She'd done all the things. She was in therapy on a regular basis. She had a good mindfulness practice. She was coping, but over the years, she tried 4 different SSRIs with different psychiatrists, and none of them worked for her at all. She always felt like the side effects were worse than the original symptoms that she was dealing with. Well, when we did her whole genome sequencing, we found 2 really key SNPs, polymorphisms, changes in her genetic code that explained why this was the case. For one of her cytochromes, the one that metabolizes most of the SSRI medications, she was a very poor metabolizer of those. And so when she was given an SSRI, those levels would build up to toxic effects, and she would get all of the side effects with none of the benefits. Further, she had a different genetic variant called an MTHFR variant, which impacts methylation, similar to that homocysteine case that we saw. But with this genetic variant, she wasn't methylating or detoxifying her neurotransmitters very efficiently. Well, with this knowledge, she was able to go back to her psychiatrist and with this informed decision, be switched to a different class of medications, an SNRI instead of an SSRI, which is metabolized by a different pathway. And on top of that, because we knew she had a methylation defect, similarly, we were able to support her with methylated B vitamins. And lo and behold, she was on the path to feeling so much better. We added in some other key things, helped her really prioritize exercise because that's just so critical for mental health. We introduced her to red light therapy and bright light in the morning by going outside, which are known to have powerful impacts on mood and such, and she was good to go. So she told us, I feel like I had got my brain back. And she'd been working on this for 8 years. Can you imagine? So that's the power of pharmacogenomics and what we can, how we can fine tune when we know what our genetic code is really expressing. Next, please. So you probably are appreciating the importance of this, but early detection saves lives. And so just a couple statistics, 2 in 9 people right now have heart disease and don't know about it. 1 in 50 people have an early treatable cancer right now, today, and many don't know about it. 2 in 7 people have prediabetes or diabetes in the early stages where we can reverse it with lifestyle change, weight loss, etc. 1 in 40 people have a treatable aneurysm. That's a blood vessel in your brain that's about to rupture. Unfortunately, I've seen what happens when those happen. When those strokes hit young adults, it can be terrible. If we can detect it on a brain MRI early, then we can get you to specialists who can tell you if something can be done about it. And 1 in 6 people have actionable genetic mutations. It's really the low-hanging fruit of personalizing your approach to your prevention and performance plan. Next slide. So as you know, you can't manage what you don't measure. And so these are 10 KPIs that I wanted to share with you all because I'm guessing chances are you have not been measuring these. Your doctors have not been measuring these, and they should be. So my question to you is, do you know these KPIs? Do you want to know these KPIs? Well, if your interest is piqued, I'd like to share with you an easy place where we can start next. So at Marqi Medical, we have a new program called our Longevity Blueprint. In my opinion, this is really a no-brainer. And so what we do is we take your existing health record out of Epic or Kaiser or whatever your health system is, all of the tests and imaging that have been done thus far, and we run it through our proprietary AI algorithm that we have been evolving over the years to give you a longevity blueprint. So this doesn't require any new imaging, any new blood tests, etc. We're just using your existing data and helping you get answers rather than guesswork from what has already been done. And we have yet to do this and not find something that is meaningful and actionable for an individual that was missed by their earlier healthcare team. So this is easy to do. You sign up as a member in our program. It's very affordable, under $2,000, and within, I think our turnaround is about a week these days. You'll get a fully actionable blueprint of what we've discovered in your existing health data and what you can do about it with things such as your exercise, your nutrition, your nutritional supplementation, questions to take back to your doctors. Lots of great actionable data. Next, please. Yeah, just a little bit more of a detail. So we take the health data that you already have, plus a questionnaire that's important to include. We want to know what your goals and your priorities are in your health and your concerns. And we put that through our MediIQ system, and out comes the analysis in your longevity health report. Next. So if you're interested in measuring your KPIs with Marqi Medical, we invite you to do that. Starting with our blueprint is a great place to start. For those who are more interested in diving into our 43,000 additional data points, we have several levels of membership that are appropriate for depending on what your goals and concerns are, where we do more of the deep dive that I've been talking to, where we'll look at all of those proactive things that maybe are not in your historic health record. Next. And so with that, perfect. Looks like I'm right on time. I'm going to open it up for some questions for the last couple minutes and invite you to book a discovery call with us. If you're curious about your KPIs and what it might look like to work with Marqi Medical, I invite you to reach out. You can request that phone call on our website there, and we'd love to talk to you about what your specific interests and concerns are and how we can help you make some longevity plans and improve your peak performance and measure your KPIs. So with that, let me turn it over to the chat. Our moderator is watching the chat box there, and we'll see if we have any questions from our participants in today's Lunch and Learn that I can answer. So we'll give it just a moment to come in here. Okay. Here's a good question. So this woman says, I was recently diagnosed with lupus after 4 years of blood tests and many tests. Do you think Marqi Medical would have found this diagnosis sooner? You know, it's impossible to say without looking at your data, but probably, especially in an autoimmune condition like lupus, where the symptoms can be kind of all over the place. There are a lot of non-specific symptoms like fatigue and muscle pain and just not feeling well. And so for people, especially with those vague symptoms, sometimes starting with our longevity blueprint can be a really easy place to begin, because we're simply doing a better and deeper analysis on your existing health records. And most people are surprised by this, but when we do obtain that full health record, of course, after your consent forms and HIPAA and all that stuff, often they're like 10,000 pages long. That's pretty typical for somebody like this woman who's been recently diagnosed with lupus. And doesn't matter how great the second opinion is at the Mayo Clinic or Cedar Sinai, like we just don't have the human power to go through 10,000 pages, right? I don't have the time to go through 10,000 pages of medical records to give you an informed second opinion. But our algorithms are trained to do that and to make sure nothing gets missed. So maybe we could have helped you diagnose that lupus a little bit sooner, or at least skip some of the runaround in the interim, so that we got you to the right specialist and the right diagnosis a little bit more quickly. Here's another question. So, say I do the longevity blueprint, and you find something, then what? Well, that's a good question. So we do offer a handful of different options, right? Let me back up. Your longevity blueprint does come with lifestyle recommendations and things that you can put into place right away, and a very comprehensive guide for questions that you might want to take back to your doctor, questions to ask, tests to request, things like that, so you can work within your health system. But if you are as frustrated with your primary care system as many of the people we work with, we do have another option. We do have Marqi Medical memberships. We have a network of extraordinary concierge physicians with expertise in integrative medicine, as well as the latest biomedical research. And so we can pair you up with an appropriate concierge physician in your area, or by telehealth, and run through these deep dive diagnostics that I was telling you about. We can do these in almost every major metropolitan area in the U.S. And so, yeah, we have options for you if you want to take this type of deep dive with us. And those operate as annual memberships. We take you through kind of a whole process. And as part of those memberships, we also have amazing health coaches that help you actually implement the recommendations that we are making. Everything from putting all of the wearable biosensor technology on you, so you have some immediate biofeedback, to doing those deep dive diagnostics. So all of those are options available for our members, and we have a couple different levels of membership. So something usually that fits for everybody. Let's see. Anything else that people want to ask about? Give it a second, see if there's any last questions. All right. Looks like we're quiet. Wonderful. All right. Well, thank you everybody for joining us today on LinkedIn for a dive into the Elite Healthcode, the 10 hidden metrics that drive longevity and peak performance. I hope you've learned something. I hope you have had a delicious, healthy lunch, and we'll wrap this up so you have a few minutes to get up and stretch for a minute before you get back to your responsibilities for the rest of your day. So thank you, and feel free to get in touch with us if you'd like to chat about it and learn a little bit more. Thank you.